Time for our Vidant Spotlight. We're going to focus on Vidant Edgecombe now, the hospital in Tarboro. And here to talk about that and some exciting news for cancer patients in that area is Susan Suter, who is the Vice President of Patient Care Services and Chief Nursing Officer for Vidant Edgecombe Hospital. Good morning, Susan.
Good morning.
Nice to see you. And Dr. Vijay Chaudhary, am I getting it right?
Yes, you are.
Is it Vijay?
Vijay.
Vijay, okay. Who is the Director of Vidant Outpatient Oncology and Co-Director of Vidant Regional Oncology for Vidant Cancer Care. Good morning to you both.
Morning.
Hey, good morning.
Exciting news, huh? Something new in Tarboro?
It is.
Yeah, tell us what's happening over there.
Super excited, Henry, to share that we actually have established the first freestanding oncology regional building with the look and feel, Vidant's new look and feel of the Vidant Cancer Care Service line. We actually have a 5,000 square foot building. Our people, a professional, skillful group that love people and love fighting and preventing cancer, fighting for the prevention of cancer. So our new building that will be open to our patients in Edgecombe County and surrounding counties on August 6th actually will have 8 spa-like infusion chairs. We're growing. Our demands have grown in the community. I think across eastern North Carolina, we have a high mortality rate, a very high. It exceeds the rest of the state's 71 counties and exceeds national mortality rates. So it's pressing for Vidant to respond to eastern North Carolina's needs in cancers. So we provided high-quality care, but we wanted a building, an environment that was respectful and healing for our patients. So we're doing that through increasing our infusion chairs. They're spa-like. We actually have beautiful windows that open into a natural healing garden. State-of-the-art technology that connects us with our Vidant system of care. We're going to keep care local. We're going to have our patients and families actually undergoing some virtual consultation. Our medical oncologist, Dr. Panda, will be able to integrate and connect with our specialists here in Greenville and across the system to really prevent our patients from having to drive when it's not necessary to receive services that we cannot provide.
And this news comes, just months after the new cancer center here in Greenville, the Joe and Eddie Smith Cancer Center, which of course is unbelievable. I've had the tour over there. Dr. Chaudhary, are you work in both? Will you be working at both places, both Edgecombe and here in Greenville?
I do provide services in Edgecombe when needed, but I'm primarily at the Cancer Tower here in Greenville.
And is the goal here is to be able to have patients in Edgecombe County not have to come to Greenville for what kind of treatments?
So absolutely, we have made that commitment to our community that patient care would be delivered close to home as much as possible within the comfort and warmth and support of their family and friends and their own networks.
How important is that to their recovery? I'm sure it's pretty important, isn't it?
Yeah, absolutely. I think it's vital that they get the care that they so need at this hour of their life. When they are stuck with a diagnosis, which is cancer, as we know, and then when they are able to get those services close to home, I think that's a huge satisfier to the patients and their families. And some of those treatments, when they need chemotherapy, it's on a recurring basis. Sometimes it's weekly, or bi-week, or twice a week, or sometimes once a month. And then to prevent those recurring visits to Greenville, we are opening up this new cancer center in Edgecombe, and then move and transition from the old building to the new building, which will have the same flavor as our cancer hospital here in Greenville.
We have, of course, we've talked about the Heart Center here for years. And I've heard the discussion about when the med school first opened, there was hardly any cancer services in Greenville and in the Vidant system. And if you got cancer, you had to be treated. You had to go to Duke or Chapel Hill most of the time. But now we've got, we've caught way up, have we not, with this? With the effort has been, and the emphasis has been on these cancer centers in the last few years here. So, I mean, I would say I have no way to rank where we stand with other places. But one thing I do know is that you do not have to travel anymore to get world-class care, even if you have cancer.
Absolutely.
Yeah, right. People in Tarboro have got to be ecstatic about this, Susan.
Oh, so excited. Yes, Henry. Actually, next week are our opening ceremonies. So we'll have a team member open house on July 24th on Tuesday, and then on Thursday, the 26th, we're going to have a ribbon cutting, and we would love for everyone to come.
So both of those are open to the public?
They're both open to the public,
Yeah.
yes. And then that evening on the 26th, 5 p.m. to 7 p.m. for folks that are working.
Okay.
But yes, they've been anticipating this for quite some time, and it's quite a stark difference. If you could see the cramped space that we've been working in into a building that's going to open up the flow, decrease wait times, allow us to make more timely appointments. Yes, the community as a whole has embraced this. We have had some very generous, and we're all very grateful for the donors who have contributed to the success of this program. And it's a pay it forward. They're helping others in the future that need these critical services. So,
Fantastic. Dr. Chaudhary is Director of Vidant Outpatient Oncology and Co-Director of the Regional Oncology. Tell us about your background. Where'd you come from?
So I'm a transplant here from Wisconsin, and I can tell you that I'm getting stir-fried in the summer. So I'm not used to 100-degree weather. But,
are you saying there's no humidity like this in Wisconsin?
not this much.
How long have you been here?
Almost a year now.
I have some bad news for you. It's actually been a very mild summer.
I think I'm transitioning very well, me and my family. So
Where were you in Wisconsin?
we were in northeast Wisconsin. Up
Near
in
the
Sac-
lakes?
Yeah.
Yeah. So it was really cool up there, right?
It was cold, yeah, but just like here, there are warm people.
Yeah. Give us your impressions of Eastern North Carolina and Vidant.
So I moved here last October, and it was primarily for the opportunity that we have. And to what you said, that people here in Eastern North Carolina, 50 years ago or so, they were traveling to Duke and UNC for the cancer treatment. And I think a majority of them did not have the resources to travel for the frequent needs and services that they need.
Right.
So, so now here in Greenville, what we have is an embodiment of the commitment that Vidant has made towards improving the cancer care delivery and improve upon the outcomes. So as we all are familiar with, cancer care incidence rates are rising, and our mortality rates for most of the cancers are dropping. Okay. However, the rates in Eastern North Carolina, on a national average, we have about a 25 to 40% higher mortality compared to the rest of the country.
What do you attribute that to? Diet? Lifestyle? I mean, what are we doing wrong over here?
So it's a confluence of factors, I will say. Diet and lifestyle being the two major players. Socioeconomic status, cultural barriers, access to care, and there potentially are genetic risk factors, and the biology of the disease also plays a role in terms of having pockets. So our Edgecombe County and Hertford County are one of the two highest mortality rate counties in Eastern North Carolina.
And when being a born and bred Eastern North Carolina guy, I mean, when I hear about all the great things that are happening with Vidant, and this is a huge issue for our whole region, because when we have these higher instances of these dreaded diseases like this, and nothing has been done about it for 100 years. I mean, Vidant is now doing something about it. So God bless all the folks at Vidant Health. I think we're so fortunate to have, an emerging world-class healthcare system here in Eastern North Carolina. It's amazing.
So at Vidant, we are making huge investments towards improving those outcomes for cancer in Eastern North Carolina to serve our patients in 29 county area, and it's a huge footprint, if you will.
Right. Yeah.
Now to have consolidation of those tertiary care services here in Greenville, and then developing our regional sites so that patients are able to achieve the best possible care, which is evidence-based, it's embedded in guidelines, and patients don't have to travel either to Greenville or to other centers for the care.
Right.
And they have the trust that the care is being delivered on the same national guidelines, and their care is at par with other leading cancer centers across the country.
Well, the access to care part is being changed. Now we've got to change our lifestyle and our eating habits, and which I'm trying to do. Just give me a-
So
all
access,
of us are always trying.
changing access is easy. Changing diet and lifestyle could be a little
Not
difficult.
as
but
easy. Not as
yeah,
easy.
yeah.
And Susan, I guess based on what Dr. Chaudhary is saying, the reason for this particular new building in Tarboro is because of the fact that it's Edgecombe County has a higher mortality rate than other counties in the east. Is that right?
Well, it is, and the fact that we had just simply outgrown the building we were in. The demand is great. We're a long hallway down from VMC, and we really want to keep. We have patients that for transportation reasons they live in Tarboro but can't get transportation to even our local center.
Right, yeah.
So yes, there's a synergy of Vidant Health cancer care across eastern North Carolina now that's just so exciting.
It's great.
Yeah.
Anything we missed that either one of you want to mention that I didn't ask you?
Well, I could mention about about how our facility is going in Greenville.
Yeah,
And,
sure. Give us an update on the new building.
Sure.
It's beautiful on the outside, and when you go in, it's beautiful. But what really matters is what's going on in the treatment rooms, right?
Right.
And
So
the care people are getting.
since opening our doors on March 26th, we have been operationalizing, the everyday runnings of the cancer center. And as you know, it's a huge undertaking, and need for our services are growing. So last week, in fact, we increased our medical oncology inpatient rooms from 28. We are up into the 40s now.
Wow.
We are hiring new nurses so that we can staff the other remaining open rooms. We actually moved our palliative care unit into the new tower, which was a huge satisfier to patients and their families.
Yeah,
They
yeah.
are up from the old building, they are into the new tower. There is access to natural light. The rooms are much bigger, which are comforting to patients and their families. And sometimes, especially on weekends, we have a large number of family members
Right,
in those
right.
rooms, and not to cram them up.
Unfortunately, my family's been through having to use that a few times, so I can tell you that's an amazing it's an amazing thing and very well run at Vidant. Yeah.
So we also opened our retail pharmacy, which is catering to both our outpatient needs as well as the ones that are admitted in the cancer hospital. And we are in the process of developing our meds to beds program so that patients, before they are discharged, a few hours before that, their prescriptions are sent to our pharmacy, and someone from our pharmacy will be able to carry those medications to the patient's bedside.
Good.
They are able to actually inform them about the directions of medications to take, talk about the interaction, and actually there is a higher level of education for patients to maintain their compliance and adherence to their prescribed medications and avoid the unnecessary side effects and interactions.
How many total beds in the new bed tower in the cancer center?
So we have a total of 96 inpatient beds, of which, the second floor, which is surgical oncology, and then part of it is palliative care. On the fourth floor, we have 48 beds as well, which is all medical oncology.
Right.
But with co-localization of all these services under one roof, if you will, it has really improved upon the delivery of cancer care.
Yeah.
So our care provider teams don't have to travel from one building to another. And as you know,
You need a golf cart now.
Yeah, we are sitting on one of the largest footprints
Yeah.
for medical campuses on the East Coast.
I will not name the physician, but a friend of mine it talks about having to walk from one end of the hospital to the other now that the cancer is, because that's on the extreme end now. And it's like it's like a half a day to get from one end to the other.
It is, but you get your steps in.
Yeah, you definitely get your steps in, no doubt. Well, hey, thank you both for being here,
Thank you.
and
for having us this
congratulations to Vidant Edgecombe for the new cancer center. It's going to be exciting stuff. And again, Susan, again, give the dates of the open house and the ribbon cutting for people in that area that want to come and be a part of that.
Thursday, July 26th is our ribbon cutting at 10:30 a.m. And then that evening from 5 to 7 p.m. we have community open house.
Come and see what's available now. We hope you don't have to use it, but unfortunately, it's just a matter of time for most families before you're dealing with cancer in some way. Yeah.
And
Yeah.
and we'll have people over there to give tours and explain the rationale for the design and the layout of the
Yeah,
clinic,
yeah.
the way it stands.
Well, my family is like just about everyone. You know, we've been touched by cancer in the last couple of years, and when it happens, it's shocking and worrisome. But the experience that we had at Vidant was amazing, and this was pre-cancer center. So I can't imagine now how I know things have gotten even better and more high tech. So God bless y'all for what you're doing over there.
All right.
Thank
Are you
very
used to
much.
hearing somebody say "God bless y'all"?
Yes,
Did they say that in Wisconsin?
absolutely.
Thank you both for being here. I know
Thank
they
you
say it in
so much.
Tarboro.
We do in Tarboro,
Yeah,
absolutely.
Susan Suter, the Vice President of Patient Care Service and Chief Nursing Officer at Vidant Edgecombe Hospital in Tarboro, and Dr. Vijay Chaudhary, the Director of Vidant Outpatient Oncology, Co-Director of Vidant Regional Oncology, Vidant Cancer Center, and another example of some of the great medical care folks who have migrated to Eastern North Carolina. In spite of the humidity, we are glad you're here. Thank you.
Me too.
Good to see you.
Thank you.